Ladies and gentlemen, it is time for our next speaker of the evening. May I present to you Dr. Daniel Kraft. Daniel is joining us live from San Francisco. Daniel, are you here?
I'm here. Can you see me?
Yes, I am. Very cool background, Daniel. So quickly to introduce Daniel Kraft is a Stanford and Harvard trained physician scientist, inventor, entrepreneur, and innovator. With over 25 years of experience in clinical practice, biomedical research, and healthcare innovation, Kraft has served as faculty chair for medicine at Singularity University and founded and is chair of Exponential medicine. Following undergraduate degrees from Brown University and Medical School at Stanford, Daniel was board certified in both internal medicine and pediatrics after completing a Harvard residency at the Massachusetts General Hospital and Boston's Children's Hospital, and fellowships in hematology, oncology, and bone marrow transplant. Welcome, Dr. Kraft. How are you?
I'm good. Good evening to you. It's morning here in California. I
Evening.
caught part of the last discussion, which was great, and looking forward to joining you. So let me know how you want to start off.
Absolutely. So Dr. Kraft, just quickly for you, Ashika Group, we are a diversified financial services group offering services such as brokerage, lending, investment banking, wealth management, and asset management. I am your moderator for the evening. I'm Ishita Jain. I'm part of Ashika Stockbroking. I hold a master's degree in biotechnology, enterprise, and entrepreneurship from Johns Hopkins, and a biochemistry degree. And before Ashika, I had a brief stint at a healthcare-focused investment bank on Wall Street. So that gets our introductions in order. The format would be that, Daniel, you would speak for about 20 minutes or so, 25 minutes, and that would be followed by a Q&A moderated by me. Is that okay?
Let's go. All right. Thanks so much for the setup. I'm going to speak for about hopefully 20 minutes. I'll speak a little bit quickly as there's a lot to cover, and then I'm happy to share a version of my slides with you afterwards because there's a lot to share here. So I'll try my sharing. And what I want to sort of infuse here is a little bit, hopefully you can see my slides, a little bit of the idea about innovation in the time of COVID, particularly in the healthcare space, how we are going to be already starting to reimagine and rethink how we're doing prevention, diagnostics, therapy, and a little bit about the post-COVID health and medical world. And that might inform a little bit your perspectives on investing in biomedicine, life sciences, and healthcare related technologies now and into the future. What future bets are you going to make? I do have some venture background. I did a Kaufman Fellowship. I've been an angel venture partner with funds, and so I'm hopefully can kind of connect some of the dots. So everyone here is familiar with technology. A lot of technology is moving quite quickly. We've obviously seen many industries disrupted over the last 10, 20 years, often at the convergence of AI, machine learning, blockchain, et cetera. Clearly, coronavirus is disrupting many businesses, and as talked about in the last session, even providing an opportunity to rethink the post-COVID world. And we really have the opportunity now to kind of look at where is healthcare or really sick care. It really has not reached the fourth industrial age where many other industries have changed, how we get our movies, how we do our banking, et cetera. So, and I think we're even recognizing that healthcare is still sometimes in the second or third industrial age. We're now fighting a 21st century disease, this new coronavirus, with pretty much 13th century technology, hand washing and staying away from your neighbors. We're still in our old modes of healthcare, waiting in waiting rooms or in lines, whether we're in San Francisco or Calcutta. The ways we sort of practice medicine haven't changed. We're still in silos of how we organize health, medicine, biotech, biopharma companies. And we often really still organize our medicine and our doctors and our healthcare systems by body parts when we're really now in a genomic age of healthcare where we can understand disease at the molecular level. So lots of opportunities to change, lots of stresses coming from our pandemic. I mean, the numbers are just breathtaking. We'll talk about exponentials. I've never used the word exponential so much in my life in bad ways. But we recognize looking at these exponential curves that sometimes small differences can make a big difference. Like I know in India now, just recently, you've now instituted social distancing or physical distancing and locked down most of the country. Every day that was done sooner, we have a dramatic increase in terms of saving lives and cost and morbidity. So here in the US, we call it stay home saving lives. I know that's more challenging in some parts of India. We have a much denser population. But we can see even in the US that is starting to work. This is from cell phone data. You can see how folks are traveling. There's less travel here in California than, let's say, Florida. And when now we can start to look at the impacts of people moving less and really being locked down. And this is data from a few days ago in California. We're starting to bend that curve. In terms of San Francisco, at least the number of new cases or those being admitted to hospitals is starting to level off or go down. So we're seeing evidence that this works, even though it's a pretty basic measure. So I'm going to try and talk a bit about healthcare in the time of COVID and to connect that to sort of the investment thesis. Let's zoom way back. Where are we today with our sick care model? Our sick care model is based on very intermittent episodic data. We get very small bits of data, your blood pressure, your EKG, maybe a lab or two. Maybe you're sending that data by fax or by PDF to your doctor if they see it at all. So intermittent episodic data leads to a very reactive sick care system. We wait for patients to show up with a heart attack, a stroke. I'm a cancer doctor with a tumor. Or now we kind of wait for the pandemic to arise. Where we really need to be globally is with our new forms of connected data, to be more continuous, much more proactive, personalized, and start to do that anytime, anywhere, arguably at much lower cost, and improving our health equity and ability for anybody with basically a mobile phone to access quality personalized healthcare and to move the needle, not just to preventing disease, but even when we get through this, back to wellness and health span and some of the most important elements. So we're dealing now with a novel virus. There's still a lot we're learning. I'm going to try and cover some of the innovations that are happening now in prevention, diagnostics, therapy, and discovery. So let's go through this in a bit. First of all, there's a lot of excitement about the future of medicine. This was actually the cover of National Geographic. I was honored to write the opening article for that issue last year. And a lot of these technologies, of course, are all around us. Many of them are sort of exponential. The power of Moore's law. Here's my antique iPhone 2. It's 10 years old, but it's quite amazing. Even 10 years ago, now it feels slow and antique. And Moore's law is the classic example of an exponential. We have the good exponential and the bad exponential. In this exponential pandemic, it's a disruptive time, but also creates new opportunities. And all new opportunities to disrupt. All those technologies some of us grew up with have now, of course, dissolved to become democratized and even demonetized into more mobile platforms. So our challenge is to think about what's possible today in the next few months, what's coming in the next couple of years, and even maybe a 10-year view, particularly from the investment perspective. Of course, our mobile phones are really becoming healthcare devices, especially in India and around Asia. We can do interesting things now, like modify them to look in your kid's ear with a microphone and speaker to diagnose an ear infection, or maybe use the microphone to listen to a patient's cough. Is that a coronavirus cough or the croup or just something else? And that's already been done in early versions with pediatric disease and pneumonia. So maybe we can modify our smartphones with AI to pick up coronavirus coughs. So in our exponential age, we now have diagnostics on our watches. We're in the era of emerging 5G, Internet of Medical Things. And those, of course, are creating massive amounts of data, right, from our wearables, our viral genomes, sequencing, medical records, imaging. The challenge is it might create new data, sometimes new knowledge, but the gap between new data to turn that into information and then clinical utility is often wide. Sometimes it's 10 or 15 or more years from something being published and acknowledged to something that becomes everyday use. And now in the era of COVID, we don't have time to have a long gap. We need to narrow that gap going forward. So a big challenge and opportunity is to kind of move forward more quickly. Some of the incentives are changing. Where healthcare happens, we're moving quickly from the traditional clinic to telemedicine for those who aren't very, very sick. We're moving to our local pharmacies where they're providing more care, more diagnostics, particularly for non-infectious disease. Telemedicine we'll talk more about later. We're seeing novel places for testing. In Korea, they're doing walkthrough booths. Lots of innovation is coming to bring healthcare from its traditional setting to novel new places. And a lot of that sort of blended with this idea of digital health, mobile health, connected health, whatever buzzword you want to use. That is enabling us now to take all these new data sources, personalize them, layer in new apps and new platforms to really bring us to a new era in healthcare. And the COVID crisis is only accelerating digital, mobile, and virtualized care. And it's not, of course, just about digital. Many technologies are converging: AI, robotics, 3D printing, synthetic biology, nanotech, blockchain. All that convergence gives us the opportunity to create entire new fields, AI and drug discovery, to digiceuticals, to VR for therapy. And it enables us to address some of these challenges, from how we might do better testing, more access to care, better use of the data so that we're upskilling everybody in real time, and even helping our regulators in the United States, the FDA, and the insurance companies to help enable new solutions faster. Already mentioned earlier, social determinants play a huge role. There's lots of disparities, particularly in India, but here in the United States as well. Your zip code is more important than your genetic code in terms of your health span. So we have real opportunities to reimagine things, just like we've reimagined Uberization for travel. Now we're seeing Uber for bringing doctor calls or delivering your drugs, maybe soon by drone. As mentioned in the introduction, I've chaired medicine for Singularity University since it started about 10, 11 years ago. We look at how do you leverage technologies to address grand challenges, including healthcare. And because healthcare is really a team sport, but also siloed, I started a program 10 years ago called Exponential Medicine. We've grown. We hopefully will still meet this year, about 800 people in San Diego, to look at all these convergences. How do we think differently about healthcare? How do we get out of our old mindsets and into new ones with our new capabilities? So if any of you have some spare time, go to exponentialmedicine.com. There's a lot of great talks from the last 7, 8 years that go into depth in a lot of amazing innovations that apply around the world and will help inform your investor thesis. I'm also involved with the X Prize. We just launched a new pandemic alliance. Some of your organizations may want to join. Go to covid19.xprize.org. We're trying to collaborate between solution providers and folks with needs and platforms. So we're collaborating to bring the best solutions up and to move those forward more quickly. All right, let's go. I've got about 10 minutes. Talk about prevention. What are we doing in prevention? Obviously, social distancing is flattening the curve. We don't yet know what's going to happen when we relax that in certain parts of the world. We've already seen in Singapore and even, resurgence of disease when new folks are coming in. We're seeing, the retooling of industries. The car industry is starting to make ventilators. The perfume industry is making hand sanitizers. We're seeing, new ways of using wearables. So back to digital, wearables can track our behaviors, our physiology. We can start to use wearables in simple ways. Someone who might be have left the hospital, are they walking more or are they walking less? That might be useful for an orthopedic procedure, but also someone recovering from infectious disease. So big picture with these new connected devices, I'm wearing a few of them, we're gonna move from quantified self, where the data lives on your phone, to quantified health. So that's gonna connect with your caregiver, with your hospital system. And we're gonna use that to do much better measurement and optimization of health, earlier diagnostics, and then much more feedback leveraged treatment. We can even use our connected screens now to tell if we're touching our face or doing unhealthy behaviors. All sorts of new digital ways to measure our good behaviors and our bad behaviors and hopefully push them in good ways. We can also start to measure at scale, this idea of crowdsourcing. How are you feeling at COVID near you? You can start to share how you're doing versus how someone else is doing and build a map of infections or reported infections around you. And I think part of this new data-driven era, with privacy concerns for sure, is we'll start to understand all the temperatures around the country. Here's United States data, and you can tell that Florida is a hotspot and is likely to have more COVID infections. We can see that our wearables, our Fitbit, can spot when people have the flu. And we're starting to see the rollout of clinical trials now that is going to use your wearable devices like this DETECT study to tell who might be having a viral illness and be able to inform them and their family and their environment early rather than late. So lots of new things emerging there. Where that's going to take us is this idea of predictalytics, to give us early guidance, early warning, kind of like the check engine light in your car, hopefully gives you early warning from hundreds of sensors to give you early prevention before you need to take your car for a big problem. And I think as we converge all this, we'll leverage our social graphs, all this information to give us real-time guidance. It may feel a bit dystopian, but next time I see Raghav, it may give me an idea whether I should shake hands with him or just do a fist bump or just do a namaste as we go down in the future. So how do we integrate this? It's a lot of new data, lots of new places. I've been working with the WHO and others to build a bit of a Waze for COVID-19, a Google Maps for COVID-19, because a lot of this data is very general. What if it was very unique and personalized to you? So we're actually building that app. It's hopefully going to roll out later this week or early next. It will be a formal WHO app that will provide triage tools and information in the right language and the right location, and then can make that data accessible to everybody. There are examples of Korea using these sorts of apps. Again, there's issues with privacy and testing, but I think it's going to become an important part of how we recover and how we measure who's sick and who's healthy. Where are we with prevention on vaccines? There's lots of work in the vaccine space. most of them are trying to target the S protein on the surface of the vaccine. Some are very unique vaccines, are DNA vaccines. A company called Inovio just started clinical trials. They could take the sequence of the tumor, the sequence of coronavirus, they received that, and then within 3 hours, they determined what was the code to make the proteins that were immune activating antigens, put them in a DNA plasmid, and now they can inject those in the skin with electricity. That's entering clinical trials. They're a very unique, new way of doing vaccinations. DNA vaccines are actually not new, but this one's already rolling out. So hopefully within a year, we'll have proven vaccines. Where are we with diagnostics? Well, there's lots of ways that coronavirus presents. It's not one size fits all. We're learning how it might present based on your age, your genome, your immune status. Lots of things we're going to learn from who's at risk, and it won't be one size fits all. We're learning, again, that's not just about temperature. It's going to be who do you test and when? How do we do smarter levels of triage? How do we leverage our digital diagnostics? So I have a whole bunch of tools around me. I can do my EKG on my phone. I could have a sort of a medical tricorder type device, which I think will be part of the future of medicine, to track my vital signs. We're going to start leveraging those in new ways. Telemedicine is happening more and more, but now you're going to have technologies in your home to start measuring your vital signs. AI stethoscopes, they can listen to heart sounds and be just as good as a highly trained cardiologist. Vital sign patches that are going to be used to keep people healthy or monitor people outside the hospital. New ways of using the immune system to predict who's going to do badly or who's going to do fine, who has a bacterial infection versus viral. So lots is happening in the diagnostic space, including using chatbots to be that first level asynchronous care, so we're not overwhelming our systems. We're seeing many versions. This one's called COVID Check to help assess people and guide them to the right levels of care. Then, of course, there's the challenge with lab testing. Lots of laboratory tests are coming online. There's in India one called Jana Care, where you can have a technology sort of snapped onto your smartphone. I think we'll see the emergence of many new versions of home-based diagnostics for many diseases. Abbott is rolling out point-of-care testing. There could be paper-based testing, and then eventually we'll be using our smartphones to take a picture of the thing and report back. So whole new ways of connecting this, kind of the idea of a medical selfie. I'm on the board of an Israeli company called Healthy.io. They've pioneered the ability to do urinary tract infection testing or urine testing. Instead of bringing your urine to the lab, you simply dip the urine, take a picture with your smartphone. The analysis is done and sent directly to the pharmacy and to your doctor. And that's going to be part of this new era of sort of mobile connected care. All right, I'm going to sort of speed up here and finish in the last 2 minutes. Artificial intelligence can start to sift our diagnostics from looking at your radiology to analyzing through ultrasounds. There's now low-cost ultrasounds, which can be used almost anywhere. They're about $2,000 US. They're democratizing diagnostics, or even being used to diagnose and look at the lungs of patients without doing CT scans and MRIs. So lots of energy happening there, including the ability to look at our eyes. And that's, of course, becoming an important diagnostic platform across India and many other parts of the world. So to finish, and I'll finish in 2 minutes, we need to start to connect the dots. All these new data streams are a bit overwhelming. We need to be smart about how we use them across healthcare. It's not going to be artificial intelligence. It's going to be intelligence augmentation for almost everybody across the healthcare paradigm. Soon, in the next 5 years, we'll all have our own personalized digital twin that can be used to predict what's going to work for us. It's also being leveraged to start developing new drugs. Several new drugs have been developed using AI, including in process for developing new treatments for COVID. So doctors aren't going to be replaced by AI, but doctors and healthcare systems who use AI will replace those who don't. I'll finish with therapy. Of course, a lot of interest in how do we treat this disease. There's actually many stages. Right now, a lot of the therapy is focused on folks who are very sick in the intensive care unit. Might we find early stage drugs? There's a lot of activity in the space, and we're going to need to be smart about crowdsourcing these clinical trials. Virtual medicine, telehealth is exploding on the scene. It's a great place to invest. I think we're not going to go back to our old ways of seeing doctors and healthcare systems in the past. Telehealth is going to be here to stay. Mental health needs to be really paid attention to. Virtual psychologists, psychiatrists, all these new things are going to change dramatically. And we're going to start prescribing apps instead of drugs. I've developed a new platform actually called digital.health. It's a website, digital.health, which is going to be a place it already exists, to prescribe digital health solutions. All right, I'm going to skip forward here. Lots of excitement and interest in 3D printing, new ways of the maker community coming together, I won't belabor that point, but there's just a lot of energy in very smartly building solutions using 3D printers and beyond. So watch that space. Drugs, of course, are of interest. I mentioned that already. Some of them are going to be quite novel. One exciting area is using antibodies from either a patient who's recovered from COVID or new monoclonal antibodies that are being developed. So those are entering trials as of this week. Old drugs like chloroquine, this has been in the news for malaria, may be effective. The data right now is quite weak, despite the fact that Trump keeps pushing it. And so there's a lot of clinical trials on board as well, even using cell therapy as a potential. I will share one area that I'm working on is actually 3D printing drugs. I think part of the future of viral care is a cocktail of drugs, just like we use for things like HIV. So I've developed a new technology called Internal Medicine. We're going to essentially 3D print our own personalized medications. And this has been done in India, not printing, but for common diseases like heart disease. Imagine the future where you can literally 3D print your own medication that's built for you and matches you. So you can watch my last TED talk from about a year ago about this. I think the future of medicine will be literally printing your own medications with your dose of aspirin, statin, beta blocker, synthroid, vitamin D that's going to help you live a long, healthy life, or eventually, if needed, have your cocktail of antivirals or antibiotics. So that's in telemedicine if anyone's interested. All right, my last minute, I promise, is discovery. We need new ways to catalyze all these new trials. Virtualized trials are here. You can all download trials today across many clinical areas. I encourage you to start trying that. Part of the future of medicine will be this idea of a Waze for health. We all don't imagine driving without Google Maps or Waze. What if we could build a crowdsourced global healthcare platform where we're all starting to share our data, just like we do when we drive, to build better healthcare maps that are localized to Mumbai or San Francisco or London, but then share that information globally. So we can all think of ourselves as not just organ or blood donors, but data donors. So I think the future of health and medicine is going to be changed by COVID. We need this convergence of often exponential technologies to think smarter about what we're going to do. I think we all need to be thinking about where we are in 2020, but also where we're going to be going with all these exponential changes and technologies in the next 5 and 10 years. And we all have the opportunity, I think, to come together to not take linear steps, but exponential steps, and not predict the future of after COVID, but create that brighter future for all of us. So there's my contact information. Sorry for going a little long, and happy to have some discussion. Thank you.
Thank you, Dr. Kraft. Do you want to switch off your screen share? So we can, great. Wow, what a presentation. Daniel, I think I have only about 75 questions to follow up on that. That was a lot of information. So quickly, I'm just going to ask a few. I know we are short on time. So, currently the planet is having a crash course in e-commerce, digital payments, work from home, remote working, and things like that. In terms of healthcare, what do you think the planet will have to take a crash course in?
I think we have to have a crash course in learning from each other and realizing that we're in this globally connected world and we need to connect faster. What happened in China, the results from the early disease were delayed in getting to the rest of the world, or something that's learned in Wuhan or in Italy or in Boston or Seattle needs to transmit to the intensive care units right away in Mumbai, so that we're all learning faster and sharing our knowledge rather than siloing it. So we're on the same planet, we're on the same team, and I think we're going to need to learn to collaborate and share in better ways, including our own personal data while maintaining privacy, thinking about smarter ways to collaborate.
So you mentioned a lot of innovation. The disaster will spell opportunity definitely for some of these innovations, and some more than the others. What would be your top innovation trend going forward that will be not an elective, but will have to be followed by everybody?
I think it's this idea of mobile, connected, digital, personalized care. The fact that all of us are carrying smartphones, they should soon know you, your genome, have your own sort of personal Siri or chatbot doctor that really understands you, your history, puts that in context. It's not like going to Dr. Google, be very specific to you. And then again, when you learn something about you, that can share with others. We're going to all be sequenced genomically within 10 years for $10 US. The more we can start to look at our genome, our digitome, our microbiome, et cetera, and leverage our mobile platforms to give us early, hopefully proactive, preventative care rather than reactive sick care, that's all going to be integrated into the future of medicine in better ways.
So there's already so much conversation about privacy when it comes to, your DIY gene testing kits and whatnot. Where do you think the privacy part fits in this entire game?
I think it's a bit of a balance, right? Here in the United States and parts of Europe, a lot of pressure on privacy. But what if the patient dies, but their privacy is intact, but you couldn't transmit the information that might have saved their life? I think they would have rather had their privacy stay. Would you want your family member or others to maybe die from an infectious disease because we were so careful about sharing data? I think it's almost like a wartime environment. We need to relax some of these things smartly, but also not go too far. It's like anything can be good for good or for bad. AI, for good, for bad. You can 3D print a gun or a pill or a medical device. So we need to be mindful, but not too scared to do what's necessary in the moment.
And I have to ask you this, in this biomedical technology-driven puzzle of the future, where do you see, where does India fit in this?
Well, I've already met, I know folks from Apollo, I've been to Mumbai, but you guys have incredible potential and a lot of unmet need. You've got rural areas with very, very little care. You've got incredible clinical research, science. So you have an opportunity to sort of leapfrog what can't be done in very sometimes over-siloed situations like we have in the United States. I think the fact that you have these personal IDs, everyone's connected on mobile devices, you can do things smarter and faster and democratize many elements of care, and bring better outcomes at lower cost. So I think you will have opportunity to lead, and then that will flow to the rest of the world. There's examples in China with an app called Good Doctor that's being used by 250 million Chinese as of, just within 2 years of launch, blending some of these lessons that are harder to do in other parts of the world. So I think India can certainly be a leader. You already are in many ways. And you also can demonstrate how a lot of advanced care can be done smarter and for lower cost.
This app you mentioned, the Chinese app, is this telemedicine?
It's called Good Doctor. It does integrate in. I mean, you don't want to go just to telemedicine. You first want to have a chatbot that knows you, asks and answers smart questions, then triages you. When you need to go talk to the doctor or the nurse, it can send you there with already the questions answered. Maybe the AI helps the doctor or the nurse in context with your vitals and others, make smarter triage decisions, and then can send you to the hospital when you need to go or provide you digital or other tools locally. So I think it's not going to be just about apps or mobile or data, but how we smartly connect systems and understand the incentives, how we pay for things, how we often have misaligned incentives. Again, pharma companies want to have a drug that's taken every day forever, not a cure. So there's a lot of changes that may need to happen in how we set up systems to work for everybody.
Absolutely. I think the crash course India will have to go through will be telemedicine. We're a few years behind, but I think the COVID-19 pandemic is going to ensure that happens. While I was at a sell-side brokerage on Wall Street, we recommended the Teladoc, the American stock. It's probably 10 times now. So finally, just to end, you've spoken a lot about future, Daniel, but here at FutureBets, we have a tradition where we ask every speaker who has been with us to mention his future bet. So what is Dr. Daniel Kraft's one future bet?
I mentioned it briefly. I mean, I think the future of medicine needs to be much more personalized, much more intelligent, much more data-driven. And so that's why I'm working on this whole, platform where, a lot of folks in India, especially, have high risk for heart disease and diabetes. And there was a trial done several years ago called Polycap, where they gave Indian men who had a risk for heart attack or stroke a single pill with aspirin, statin, beta blocker, and an ACE inhibitor. And it lowered their event rate for heart attack and stroke. But that wasn't very personalized. What if you built an individualized personalization or longevity pill for everybody? It was really blended for that. That's why I'm sort of building these in telemedicine pills, talk to me first in the company. But I think, and those will be much more data-driven, based on your genome, based on your blood pressure that's going to come off your watch, not a blood pressure cuff, based on your scale, based on your mood. Now, it's not all about pushing medicines on people. I think we should be preventative. But for those who do need medicines, we can do a much better job of the right dose, the right combination, and the right feedback cycle, so that we're, essentially printing a new medicine for you on your breakfast counter every day that matches what you need based on your blood levels, your symptoms, et cetera, for those who need it. So data-driven, personalized, and feedback loop-driven healthcare, I think, is where we're going to hopefully head. And that intelligence, again, is globalized, and we're crowdsourcing that as we move forward.
That's phenomenal. That's phenomenal, Daniel. I'm being signaling that I have to let you go now, but I do have to absolutely mention that when this pandemic is under control and when sort of normalcy establishes itself again and you have travel, the next time you come to India, we at Ashika Group would love to host you.
It'd be great to be there. Thank you.
Okay. Thank you, Daniel. Thank you, everybody. See you tomorrow.